Hello, everyone. So, doctor, what is this streptococcus microbe? What is it? What problems does it cause? And what does it do? We actually made a video about this, and I'll leave the link for you where we explained it in detail. But since I've received so many questions about this topic, I felt we should talk about it again. This streptococcal microbe is a bacterium. It's not a virus. Under a microscope, it looks like a string of beads. Where does it appear? It usually appears in the tonsils. It can affect the entire respiratory system and even the urinary system, but its presence in the respiratory system is the most common, and the most common place it appears is the tonsils. What are its symptoms? Its symptoms are like any tonsil infection, but it causes a purulent infection. This means the tonsils become inflamed and collect pus, and usually, when this problem occurs, the person complains of a very sore throat, a high temperature, their whole body aches, and they feel a tonsil infection. But it's not like a regular infection that doesn't have pus. This purulent infection is much more severe. It raises the body temperature in most cases. Its treatment is like that for a regular tonsil infection. But we often need to administer intravenous antibiotics for 2 or 3 days or so. After that, we continue the treatment with antibiotic pills only. It's a standard treatment. We don't need particularly strong antibiotics or anything, but we might need injections, as we said. And after that, we continue with oral medication. So what's the well-known story about this streptococcal microbe causing joint pain and rheumatic heart disease and things like that? We've said that the streptococcal microbe, like any microbe that enters the body, is recognized by our immune system. It takes a sort of snapshot of it and prepares antibodies, so that if it enters the body at any time, our body can deal with it before it causes us any harm. The problem is that in some people, the antibodies formed against this streptococcal microbe get confused. These antibodies get mixed up between the microbe and parts of our own body. Parts like what? Like parts of the brain, the heart valves, and some of the tissues found in the joints, especially the large joints like the knee, the elbow, and the shoulder. When that happens, when the immune system creates antibodies that get confused and attached to these places instead of the streptococcal microbe, inflammation occurs. This causes problems with the heart valves, which is what we call rheumatic heart disease, or problems in the joints, or, in children, problems in certain areas of the brain that cause involuntary movements. Now, a great many people ask me, if I get a strep infection, does that mean I will necessarily get rheumatic heart disease or something similar? No. A question I'm asked very often is, does a high level of antibodies to the streptococcal microbe prove that we have the disease, meaning rheumatic heart disease that affects the valves? Of course not. A high level of antibodies in the blood simply means that we get frequent infections with the streptococcal microbe. That's all. Does it cause any harm? No, we don't rely on the high level alone to say that it has caused a problem. The level can be high and everything, but no problem occurs. And a high level doesn't mean that we necessarily have to remove the tonsils. No, we remove the tonsils when this high level is a factor, and there are many other things diagnosed by the internist and the cardiologist that lead them to tell us, no, the streptococcal microbe here is very harmful, and we need to close off the path it's using to enter, which is the tonsils. Tonsil infections are the gateway through which this streptococcal microbe enters our body. Therefore, we try to reduce it, either by removing the tonsils or by taking antibiotics like long-acting penicillin, which is taken over a long period. We take it every 3 weeks. Some say 2 weeks, some say 3, and some even say every month. It's a single injection that gives us protection from the streptococcal microbe so it doesn't enter our body. Tonsillectomy is one of these solutions. But not everyone with a test showing high antibodies to the streptococcal microbe has to have surgery or has this rheumatic disease. Absolutely not. It's one factor among many that helps us determine whether we need to remove the tonsils or treat this rheumatic disease or not. So, is the streptococcal microbe contagious? That's a question I'm also asked a lot. It is contagious, yes. It's contagious at the level of a throat infection, meaning someone with tonsillitis and a purulent infection can infect another person with purulent tonsillitis or with the streptococcal microbe. But rheumatic heart disease, or the problem that occurs inside the body from exposure to the streptococcal microbe, has nothing to do with contagion. It's not contagious. So it's not like someone with rheumatic heart disease can infect another person and give them rheumatic heart disease. No. They infect them with the streptococcal microbe, and in some people, that microbe causes this problem. All right? Does this streptococcal microbe cause weight loss? No. How is this streptococcal microbe contagious? It's contagious through saliva, or it's not like viruses. Viruses are much more contagious than bacteria. Bacteria require you to touch or come into contact with the secretions containing this streptococcal microbe through close proximity, meaning you won't get infected through the air or by entering a place where someone with a streptococcal infection was and just catch it. No, that doesn't happen. It's not like viruses. Its contagion is a little less widespread than that of viruses. Wishing you the very best of health. If you enjoy these videos, please give us a like and subscribe to the channel so we know you're looking forward to more new videos from us.